Well, hey guys, in today's video, I'm going to talk all about plasma pen, otherwise known as fibroblast therapy or fibroblastin. Sounds like a party. I'm going to be talking about what this procedure does, how it works, what you can expect with it as far as results, downtime, side effects. I'm going to be covering why you might consider getting it, its advantages over other treatments, how it compares to other procedures, and I'm going to be giving you some reasons why you might want to avoid it. If you're new here, welcome. My name's Andrea. I'm a board certified dermatologist. I have a lot of videos talking about different cosmetic procedures, and they're all saved in a playlist called Cosmetic Procedures. So check that out if you are at all interested. What is plasma pen? It's a non-invasive treatment that aims to improve the look of wrinkles, fine lines, and saggy skin. It's called fibroblasting or fibroblast therapy because its aim is to target the fibroblasts. Fibroblasts are the cell type in the deeper layers of the skin that produce collagen. And you guys know that with age and time, we lose collagen in the deeper layers of the skin, and that is what leads to wrinkles and saggy skin. Speaking of fine lines and wrinkles, I want to give a shout out to a favorite product of mine for the temporary improvement of fine lines and wrinkle smoothing, and that is these CO silicone patches. I've been using these for well over a year now, actually. And the way they work is by plumping up the top layer of the skin, giving a wrinkle smoothing effect. They're reusable. You can use them up to 10 times. I love the neck patch in particular. It's really good for just smoothing out the neck of those tech neck lines that we all are plagued by. Anyways, I get these on Skinstore, and Skinstore is actually sponsoring today's video. And you guys, they're having a huge sale right now, their friends and family sale. And up until October 12th, these are actually on sale, 25% off. But if you use my code Dr Dray 10, you can get an additional 10% off the already sale price on these. So take advantage of it. I know you guys love these. They are reusable. I just put them on at nighttime to clean dry skin. If you're wearing a heavy moisturizer, they won't adhere well, but if you're wearing like a lightweight serum or something, just allow it to absorb fully and then put these on. You leave them on, you can sleep in them. Then the following morning, you gently remove them and you just get this nice smoothing effect. It really helps lock in hydration as you sleep. The forehead patch is really good to wear if you're doing a lot of computer work, because not only does it kind of help smooth out those fine lines, but it also kind of helps keep you from doing like that. Just reduce those repetitive, unnecessary facial movements. Anyways, right now Skinstore is having a huge sale, their friends and family sale, up until October 12th. And these are actually 25% off, but they gave me a code Dr Dray 10, and you can get an additional 10% off the CO patches in addition to the sale price. I also have another code Dr Dray that will get you 25% off other non-sale purchases. Now, these are not going to cure or prevent wrinkles, and they're certainly not going to tighten skin, but they really do help improve the look of fine lines temporarily. They're great if you're gonna have photos taken the next day and you just wanna improve kind of that fine wrinkling. It's a really good way. Really locks in hydration. I love these. They also make them for the chest too. So if you're a side sleeper and you're developing chest wrinkles, chest creasing, try the chest patches. They're really comfortable actually to wear at nighttime. I don't even notice that I have them on. Like laser resurfacing or microneedling, the goal of plasma pen is to trigger the healing pathways that lead to fibroblasts making new healthy collagen. So ultimately you will get a skin firming effect and a smoothing out of wrinkles and fine lines. This procedure also can be pursued for acne scars, stretch marks, and a variety of benign skin growths like seborrheic keratoses, sebaceous hyperplasia, and skin tags. The plasma in plasma pen refers to the fact that the pen converts electrical energy into plasma. And basically you have nitrogen and oxygen gases that desiccate the top epidermis, promoting contraction and stimulating those healing pathways deep down in the skin to boost up collagen production from fibroblasts. So that's why it's called plasma pen or fibroblasting, because you're targeting those areas and you're using that fourth state of matter plasma. It creates uniform rows of tiny little burn marks that stimulate healing pathways deep down. So if you've ever seen anyone who's had it done, they have all of these little rows of dots that are kind of scabby and crusty. People who will benefit from this procedure are those who have very mild sagging, and it's good to use in small areas But because of the nature of the way the pen is used, it's difficult to use it to large areas. So it's more so used in small areas on the face, like around the eyes, around the mouth for like smoker's lines. It's used for crow's feet. It can be used to the marionette lines, smile lines. And it also, like I said, can be used to remove a variety of benign skin growths. The procedure lasts anywhere from 10 to 45 minutes, depending on the size of the site that you're having treated. Because this procedure is painful, you're gonna have numbing cream put on first, and once the skin is numb, then the provider is gonna use the pen to deliver energy in a dot grid fashion to the skin. And after the procedure, then they're going to apply plain petrolatum. Now, as far as expectations, it's important to realize you're gonna have some downtime with this procedure. It is not an in and out lunchtime type of thing. You're gonna need about a week to recover. First, you're gonna have some redness, possibly some swelling, especially around the skin of the eyelids, which is much thinner skin. And then that typically resolves after a couple of days, but within a week, you're gonna get flaking, dryness, and a lot of scabbing. You shouldn't use any skincare products to the area 48 hours after the procedure. You don't even want to wash your face or use any cleanser on the skin as in that first 48-hour period. And then after the first 48 hours, then you can transition to like a really, really gentle non-soap cleanser. But remember, this is basically healing skin, so you want to baby it and be very, very careful. Strict sun protection is essential. For the first 48 hours, you don't want to do anything that's basically going to cause you to sweat or generate heat, because this will cause a lot of irritation and put you more at risk for side effects of hyperpigmentation and poor healing. For example, you don't want to work out immediately afterwards, or really you want to wait 48 hours before working out. You certainly wouldn't want to go in a sauna or steam room. Anything that's going to cause you to get really sweaty would not be a good idea. And whatever you do, do not pick at the scabs. Scabs are kind of a natural bandage, and if you pick them, you run the risk of scarring and infection. No makeup until the scabs fall off, and whatever you do, you do not want to use any active ingredients. No alpha hydroxy acids, no salicylic acid, no retinoids, no harsh scrubs, no scrubs, period, for 3 weeks after this procedure, because the skin is healing and recovering, and the goal is to boost up collagen production. You don't want to interfere with the healing pathways by causing too much irritation. Likewise, you don't want to have any waxing for 21 days after the procedure. How soon until you start seeing results? You can see subtle results in as early as 1 week after the procedure, but really the bulk of what you're gonna see in terms of benefit is not gonna be obvious until around 6 to 8 weeks. You typically need more than one treatment, and it depends on the area being treated and your age. Younger people are gonna see more of a dramatic result with fewer treatments than people who have maybe slightly more prominent sagging as a result of age-related changes. The results that you get with this procedure are definitely not as dramatic as what you would get with laser resurfacing or radiofrequency microneedling. This procedure is really popular for people who deal with hooded eyelids, and for mild cases of upper eyelid sagging, then yes, you can appreciate some modest benefit with this that, may be what you're looking for. However, for prominent sagging, especially if it's interfering with your vision, then that's gonna be blepharoplasty or lid lift. But as a reminder from my video on hooded eyelids and blepharoplasty, if it's to a point where the sagging is interfering with your vision, well, insurance often will pay for blepharoplasty, the procedure, the lid lift. And as far as removing benign skin growths like skin tags, sebaceous hyperplasia, it's not any better than less costly treatments like electrodesiccation or cryotherapy. So I wouldn't say that this is somehow superior to those less costly treatments. Speaking of cost, how much does this cost? Well, it's going to vary, of course, depending on where you live and the size of the area being treated, but on average, it's roughly around $800. Now, while you may see some subtle improvement in as little as 1 week, do realize that it's going to take about 6 to 8 weeks before you really start seeing improvement. But on actual biopsy, skin biopsy, we have evidence that you get new collagen production and an improvement and reduction in what's called elastosis, basically skin damage from the age-related change in UV exposure, you get improvements in those markers outwards of over a year, actually, of ongoing improvement. And that improvement is permanent. It's permanent in the sense that you don't need to keep getting plasma pen in order to maintain the results. However, it does not stop the aging process, and it doesn't protect you from UV damage from the sun. So you obviously need to continue to protect your skin from the sun, and it's not going to, put the brakes on aging. So it's not like that collagen is somehow resilient to all of age-related change, but it is permanent. You don't need to keep getting the procedure in order to maintain those results. Side effects of this procedure can include, to be expected, some redness and swelling. That's typically mild and is temporary. You can also get acne flares. You can get milia formation, blisters, and of course you can get scarring. This happens when a provider lingers too long on a given area, and it's going to create a crater that's either too wide or too deep. And then you have hyperpigmentation. You can either have hyperpigmentation that's temporary, or you can have permanent hyperpigmentation. So who should not do this procedure? People with deeper skin tones. This is not a good procedure for you because you definitely can develop post-inflammatory hyperpigmentation that does not go away. In fact, that is one of the most common reasons for dissatisfaction with this procedure is hyperpigmentation. Make sure that you go to somebody who is well-trained in this, a well-trained, experienced doctor or a nurse or a physician's assistant under the supervision of a doctor. What about an esthetician? Now, the laws regulating whether or not an esthetician can do this procedure vary depending on what state you're in. Avoid doing this at home. I know that that is always an unpopular opinion of mine, but it is my opinion as a dermatologist that you should avoid buying those at-home plasma pen devices. They are not regulated, and a lot of them are really problematic, can cause serious harm to your skin. I do not recommend buying those or using them. You can really disfigure yourself with those. So I don't, avoid doing it yourself at home. I mean, it is a procedure that has side effects and risks that can be permanent, even in the hands of somebody who is doing this as their profession. So doing it on yourself at home or on someone else, highly discourage that. And in fact, Canada came out with a statement saying that the plasma pen has potential for harm, adverse effects, and basically you cannot buy those devices in Canada. So don't do it at home. Definitely avoid doing it at home. All right, what are the pros of this procedure? The pros are that it's great for really small areas with mild sagging, areas where maybe you couldn't really get microneedling in well. Great for treating areas like the crow's feet, fine lines and wrinkles around the eyes, smoker's lines and wrinkles around the mouth, marionette lines. It can be used to treat stretch marks. It's gonna offer a subtle lift, which that's exactly what many people are looking for. It also can be used to treat a variety of benign skin growths like skin tags, seborrheic keratoses, and sebaceous hyperplasia. It can be used to improve the look of stretch marks. I know $800 is a lot of money, but in the landscape of cosmetic procedures, that's actually not as expensive. And so people desire this procedure because maybe it's more within their budget. And the other advantage is that the new collagen produced is long lasting, so you don't have to keep going in and getting this done over and over again. Cons, it's not safe for Fitzpatrick type 4 and 5, and it's not as effective as laser resurfacing or radiofrequency microneedling in terms of the improvement in wrinkle depth and skin firming, skin tightening. So it's not going to be useful at all if you have moderate to severe skin laxity. And in the case of moderate to severe skin laxity, that's going to be cosmetic surgery, especially around the eyes when we're talking about hooded eyes. That's going to be a blepharoplasty. Don't expect that. Especially if you have sagging around the eyes that is impairing your vision, then that's going to be surgery. And remember, your insurance might cover it in that case. The other con is that there's a greater risk of adverse effects with plasma pen than with resurfacing laser or with radiofrequency microneedling, because it's not as easy actually to control the ablation as it is with those those devices. If you're interested in this procedure, hopefully this video was helpful to you, but I do strongly encourage you to meet with a board certified dermatologist or plastic surgeon who has expertise in this, because they're going to be able to tell you, is this procedure the right one for you? Is it going to target what you're looking to improve appropriately, or is there another procedure that would be better suited for you? They're going to be able to set your expectations from the get-go with the consultation of what you can expect with this type of procedure, if it's right for you, or if it's just not going to give you any kind of results that you need or that you're looking for. Depending on the area, the extent of sagging, is there another procedure that you would be a better candidate for? So not only do I not recommend that you use the at-home plasma pen, but I definitely strongly discourage the use of these devices to remove any skin growth, because skin lesions, they may look benign to you, but they could actually be an early skin cancer, and removing it can make it more difficult to diagnose it and remove it appropriately. And you're not going to be able to remove a skin cancer with this procedure. So please, I urge you to not use these at-home devices in an effort to remove what you think is a skin tag, a mole, anything. A basal cell carcinoma that you try and treat thinking it is just a sebaceous hyperplasia, they can look similar. Basal cell carcinoma can look like sebaceous hyperplasia. So trying to remove that yourself with an at-home plasma pen, well, that basal cell carcinoma, it's under the skin and it's going to continue to grow and become more invasive. And then you're going to have a more extensive surgery. So do not at home plasma pen yourself. All right, guys, let me know in the comments, have you had this procedure done? Did you get the results that you were hoping for? I hope this was informative. And don't forget to check out the Skinstore Friends and Family Sale going on until October 12th. So thank you, Skinstore, for sponsoring today's video. And if you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.